Do you think the focus on understanding that it's a language-based disorder is having a beneficial effect on the interventions we then try with students? Trying to break
I
those myths? Yeah.
Yes.
Mhm.
Well, it certainly should, because if we are more accurate in targeting the actual cause of the problem, then we can zero in on those interventions. And
Mhm.
so if we do, and there is a broad general consensus, there are still lots of areas about dyslexia that even research scientists are still disagreeing about. But one of the areas of really solid agreement is that the primary difficulty is the brain difficulty to inability. We also come to understand accurately dyslexia as a spectrum
Mhm.
disorder. So you
Yeah.
can, in fact, a brain can have absolute inability to process the
Mhm.
phonemes, the sounds of words, or difficulty or mild difficulty. But that is what we consider universally as agreement in the research community, that that's what dyslexia is. So there's good news that comes with that in terms of intervention. That part of the brain is malleable to rewiring, to becoming more functional. Of course, if you're on that spectrum of a severe disorder, it's going to be harder to rewire the brain, to change the brain, to correct that processing. But we do know, like all aspects of learning, that the earlier we start, the better, because of what we've come to understand of neuroplasticity, that our brains do age and become less able to
Mhm.
be rewired or learn new anything. We're all better at learning a new language when we're younger than when we're older for these reasons. So yes, the more we've come to understand that the basic essence for most children that we would consider dyslexic is their brain's difficulty processing those sounds, we can start our intervention with that, the deep attention on phoneme awareness and helping children get that. Of course, if the early we start, the better, but then that intervention has to be age appropriate. We wouldn't work with a 3-year-old or a 4-year-old in the same way we would work with a 7 or 8-year-old or a 17-year-old or a 63-year-old. All those ages we can attempt to do some intervention, but it's always better to start early.